Hello everyone, welcome back to my channel. In this video I'm going to talk about the angina pectoris, which is a common disease of the heart occurring in the heart. So it is basically due to the coronary artery disease, which supplies the cardiac muscles. So we have three coronary artery which supplies the heart muscles. Angina pectoris disease is marked by brief, sudden attacks of chest pain or discomfort caused by deficient oxygenation of heart muscles. So, angina pectoris is usually, as told, is due to impaired blood flow to the heart. Talking about the formation of angina, how it is formed, what is the etiology, then damage or injury to the blood vessels, inner layer, smoking, and high cholesterol are some of the factors that contributes to the angina. So understanding the pathophysiology, consuming all the etiology, there will be an increased oxygen demand. So with the increased oxygen demand, heart workload is increased, which ultimately leads to the more blood supply to the heart. Then coronary artery dilate due to this reason, supplying more blood vessels, which leads to defected blood supply and again leading to more blood supply. This all process results in decrease in blood flow. Now we have types of angina, 4 types: stable, unstable, variant angina, and nocturnal angina pectoris. What are the risk factors? Modifiable risk factors which can be modified. Non-modifiable is due to older age, diabetes, blood pressure, family history. Modifiable is like tobacco use, because of high blood cholesterol, which can be modified. Lack of exercise, obesity, and stress are some of the factors which can be modified. Causes: development of atherosclerosis in the coronary artery is the beginning of the reason for the angina pectoris. Is thought to begin with the damage or injury to the inner layer of coronary artery, sometimes as early as childhood. So due to any cause, as I already told, the pathophysiology is because there is an increased oxygen demand due to some of the factors which led to the demand supply to be increased, which increases the heart workload and heart is failing to do so. Now the symptoms, cardiovascular symptoms of angina is the sensation of chest pains, pressure, squeezing pain, often due to insufficient blood flow. Ischemia, low cardiac output, chest pain, myocardial infarction, diaphoresis, that is excessive sweating. ECG changes, what we will observe is ST segment and T wave changes, which shows tachycardia, bradycardia, or dysarrhythmias. Dysarrhythmias is that the regular heartbeat is not observed in the patient of angina. Ischemia, because there is a decreased blood supply, so there will be ischemia, which ultimately leads to the damage of cardiac muscles. Chest pain may be sometimes occur suddenly, severe, immobilizing, and it may be relieved by the rest or not relieved by the rest, position change, and medications. BP may be elevated because of sympathetic stimulations, or decreased BP because of decreased continuity. Respiratory angina, we had talked about the cardiovascular. Now respiratory, symptoms are shortness of breath, patient is unable to breathe properly, pulmonary edema, chest heaviness, and dyspnea, that is difficulty of breathing. Fatigue are some of the factors which some of the symptoms which is shown in the patients with angina. They have this shortness of breath. Now we'll understand the genitourinary and gastrointestinal and skin media symptoms we will get. In the genitourinary system, there will be a decreased urinary output, there will be nausea and vomiting. Diagnostic evaluation, we will do the physical examination, history collection, and a stress test, which is the TMT, treadmill test we will perform to get the diagnostic evaluation. If the patient is having how much of angina, what is the level of angina he has got, what is the level of heart damage he has got. So if this is the chest x-ray, then you can see the heart where we can clearly visible the right atrium, left atrium, ventricle, and the inferior vena cava. Similarly, all the vessels. Understanding the ECG diagram, what we will look for is the PR interval, QRS duration, and QT interval is an ST segment. This we will check in the ECG diagram if it is elevated or showing some abnormal pattern. We will check for that. Now this is the echocardiogram, through which we will check for the muscles activity of the heart. There is a transducer which is applied on the chest, and then it shows the images on the screen. Cardiac catheterization is also performed to check the arteries, is there any blockage, and if there is blockage, then where it is and how much. Now the complications of angina is basically the heart attack, heart failure. What we can do to prevent it is quitting smoking, monitoring and controlling other health conditions such as BP, cholesterol, diabetes, eating a healthy diet and maintaining a healthy weight, increasing physical activity. Aim for 150 minutes of moderate activity each week. Plus, it's recommended that person get 10 minutes of strength training twice a week and to stretch 3 times a week for 5 to 10 minutes each time. You should reduce your stress level, limit alcohol consumptions to 2 drinks or fewer a day for men and 1 drink a day or less for women. Now, understanding the medical management. Various drugs can be used to treat coronary artery disease, which includes the vasodilators, beta blockers, calcium channel blockers. Vasodilators includes the drugs like nitrates, beta blockers, which work on the which decreases the workloads like the propranolol. Anticoagulant drugs are used. So as we can see here in the chart, I have summarized nitrates, which may be short acting, long acting, beta blockers, calcium channel blockers, and other anti-anginal drugs and channel opener. So these are the drugs which are given as the anti-anginal drugs in combination. Verapamil hydrochloride, amlodipine tablets, atenolol tablets, anticoagulant drugs like heparin, opiate analgesics which will reduce the pain like morphine sulfate, thrombolytic, this antihypertensive medicines, methidopa. This medication is used alone or with other medications to treat the high BP. Sodium nitroprusside, this is very important in lowering the BP. Amlodipine, as I said, is used with or without other medications to treat the BP. So there are 3 medications for treating the BP. The main one is sodium nitroprusside. Surgical management is angioplasty and then stent placement. So it is done percutaneous coronary artery bypass surgery, where the saphenous vein is bypassed, left internal artery is removed. Nursing management. So in nursing management, important one is that instruct client regarding a low calorie, low sodium, low cholesterol, low fat diet with increase in dietary fibers and stress to be avoided. Nursing diagnosis, if there is impaired physical mobility, imbalanced nutrition, less than body requirement related to less intake of food, disturbed sleep pattern, anxiety related to hospitalization, knowledge deficient related to disease process, and impaired gas exchange related to decreased blood oxygen supply. Research studies have shown that sleeping less than 4 hours or more than 8 hours at night increases the risk of dying from some types of coronary heart disease such as heart attacks and unstable angina pectoris, according to the study by Norwegian and Taiwanese researchers. This is the single largest study that has looked at how sleep duration affects the risk of dying from cardiovascular diseases. Our results show that enough but not too much sleep is important for a healthy lifestyle.